Once again, welcome to KID Gulf Sasa TV. We are live. We want to talk about how to get nursing jobs in Dubai. And our guest this evening is Dr. Ryan.
Sure. So I would like to introduce myself just so briefly. My name is Ryan Tay, and I'm a general practitioner from Kenya. I'm 27 years old, and in Kenya, we are classified as medical officers, whereby one graduates with a bachelor's degree in medicine and surgery after 6 years of training and 1 year of internship. So basically, I am that. And I'm from Kenya. I'm a very proud Cambodian. I don't know whether you know what that means, Habs. Do you know what Cambodians mean?
Yes, I do.
You do. Yeah, I'm from Kitui County. Yeah. So that's exactly what Cambodians mean. I think we'll just go straight to exactly what you wanted to know from me, so that of course the other people who are following can grasp some one or two things from this interview.
All right, straight away, if someone is in Kenya, a medical practitioner wants to work in Dubai, what are the requirements and the education level required for them to get it? Yes.
Yeah, sure. It will depend on the cadre, and I'll just go to the general concept. What really is required as a professional coming to the UAE to work as a professional healthcare provider or so. So I'll give you the general overview. Of course, you need your academic documents. You need to have trained in an institution in Kenya that is recognized in Kenya itself and in other parts of the world, including the UAE. So I would start maybe with what I am personally. I'm a doctor. So for you to come to the UAE to to practice as a doctor or as a dentist, because you are classified in the same category, or as a pharmacist, you need to have completed your study. For doctors, it's 6 years in Kenya now currently, and after that, you need to have completed 1 year of internship, which is supervised working, in your home country, and an extra 2 years of clinical experience in a government facility in your home country, which we are talking about Kenya here. And you should note that experience that is acquired from volunteering or internship, still post internship, or working in private hospitals is not counted as an experience that can earn you a license or can earn you, a chance to practice as a practitioner in the UAE. That's for physicians or medical officers or doctors and pharmacists and dentists. When you go to the other cadres like nurses, which are, that's a cadre that is on a very high demand in the UAE, you again need to have completed your studies. And for the nurses, at least they are lenient because you can have completed your diploma. There's a difference, between a diploma and a degree. In Kenya, a diploma goes for 2.5 years, 3 years, or your degree. And after your degree in nursing or your diploma, people from the Kenya Medical Training College go to have their diploma. People from the universities like Kenyatta University, like Mount Kenya University, have their degree. So after that, it's a requirement that you complete your 6 months of internship and then get a further 2 years of experience again in your home country so that you are eligible to come and practice in the UAE. Again, generally, there are things that apply generally. Like before you come to the UAE, there are things that you need to have. We'll still go and break down all the categories that you want us to break down, but there are things that you really need to get right before you come. First thing, your academic documents. And they start, academic documents start from your elementary levels, like the primary school in Kenya. But here they look at, the O levels, the A levels. I mean, from Form 1 to Form 4. So they would look at your KCSE certificate. It needs to be stamped at the school that you went to in high school. Then you take it to the Ministry of Education for it to be stamped and attested. That's what it's called attestation, to show that this is a real original document that you got from that school, and this is the real document that was released by the Ministry of Education. After that, you will go to, I'll even give you the specific rooms. You'll go to room 32 in room 32 of, like in GPO, Huduma Center. You get what is called, attestation of GPO. Not GPO. It's City Square. City Square,
Okay.
City Square, that office that is there. You get your attestation now by the Ministry of Foreign Affairs. Now, after getting from your school, from the Ministry of Education, you go to City Square. You get now from the Ministry of Foreign Affairs. Then, after taking to the Ministry of Foreign Affairs, the Foreign Affairs will give you now a letter that you take to the embassy of the UAE in Nairobi, so that you get your document attested. That's the certificate from your high school. After that, together with that, you also need your degree or your diploma certificate. You go to your university or the college where you graduated from, you get the stamp again and the signature. You go to the Ministry of Education, you get the same, and you also go to the Ministry of Foreign Affairs. Same thing applies to your license, the practicing license. If you have a practicing license that you have been using in Kenya, you also need to get it attested at all those levels. So that's the first step of someone who wants to come to the UAE. The cost, averagely, people, because we'll ask about the cost is 160 dirhams, which is an equivalent to 5,000 Kenyan shillings. 160, 165, 5,000 Kenyan shillings per document. So when you go there, I remember some of my friends when we were coming here early this year, they didn't know that it was that much expensive, because now it means that if you have to attest like 6 documents, you have to cough out around 30,000 Kenyan shillings. So you must be prepared. It's 5,000 for each document, and you have to go, even if you are in Nairobi and your school was in Turkana, for example, you have to go back there and get that signature. It doesn't matter whether you've booked your flight or not. For me, I had to cancel my flight and reschedule again, and I was of course fined 9,000 Kenyan shillings. So that's basically it for the if you want to come for the those are the documents. Again, the other thing that you have to note very well is what you call the police good conduct. I understand when you come to the UAE it won't matter so much, but Habib, you've been on the watch out, you've been active here and there. You know that right now they want your good conduct certificate from your home country, especially for the people who will be coming after this COVID pandemic is over. Again, you need something that is called a good standing certificate, which is different from the good conduct certificate. Good standing certificate, Habib, means you go to your licensure board, like you go to your like for me it's Kenya Medical Practitioners and Dentists Board. I go there, I get a certificate that I'm clean, so that I can come and practice here. It's like saying that this person is clean. So those are some of the documents that you need when you're coming here. The others are common things. The others will even know when you come here.
Dr. Ryan, I would like you to also talk about the DHA certificate.
Yeah, we need to talk about the DHA certificate, but I would appreciate if we talked about the entire scope, because we are talking about people, I understand we are the Kenyans in Dubai TV, but again, we are also looking at people generally coming to the United Arab Emirates. if you would allow me, because we have Abu Dhabi, we have Sharjah, we have Fujairah, we have Ras Al Khaimah, we have so many, we have the 7 Emirates. So, and
Please
you
go
find
ahead.
Dubai is DHA, Dubai Health Authority.
Okay.
Abu Dhabi is the
Yes.
Health Authority of Abu Dhabi, or Department of Health in Abu Dhabi. For Sharjah and the other 5 Emirates is a Ministry of Health and Prevention. So there's a process. There's what we call the data flow process. Data flow process is whereby it's a process that you are taken through before you are licensed. And when you come with your papers, they are now put. Actually, you can even do the data flow process when you are home, when you are in your home country, but it's not advisable anyway. So when you come with your documents, I forgot one thing about coming from home. You also need transcripts from your former university, which are certified by that university. Transcripts means like in high school we had report forms. You need those marks, like in English you got this in your college, not in your high school. The college that gave you a degree or a diploma to practice as a to qualify as a healthcare professional or worker. You need those transcripts. So when you come in, they take you through what is called data flow. So data flow, they look at certificate of good standing, not good conduct, good standing. That one from your board, your licensing board. Then they look at your academic documents. Then they also look at the transcripts, and of course, general things are big like passport and you understand that. And these documents, something happens that is called a primary source verification. Primary source verification means that this document is sent, it's sent to your home country. It takes time. It is sent to your home country to confirm whether it's a real document. You have attested it, yes. You have put the stamp, yes. But then it is still sent back to your home country to make sure that is a real document. So your KCSE is sent, your degree is sent, just degree, not KCSE. Your license is sent, and your certificate of good conduct and your transcripts are sent back to your home country. I don't know whether they do it by sea or by what, but they send them. If there is any discrepancy, then they will ask you. Again, something I overlooked. When we talk about internship, completing internship, you have to have an internship completion letter from where you practiced. Then these are 2 years experience again on top. You have to, like for me, I was working for the county government. So you have to have a letter from that hospital that you are working for, showing that you worked there for that time. And they'll also send those documents again to the human resource in that hospital. It's very strict, so you cannot it's not like those zile CVs zenye tunapakaga mafuta, si unaelewa. You cannot do that, because eventually they'll be sent to your home country, and then that HR, if, of course you didn't work there, be able to commit that you worked there. So that's the data flow. After you pass the data flow process, let me just finish on that. After you've passed the data flow process, which takes around a month, can take around a month or even more, now you sit for an exam, for the licensing exam. If you pass the exam, most people don't pass the exams, they do it twice or thrice. If you pass the exams, then now you are given the license. It's as easy as that. They just need to see you have the experience and that you have authentic documents. There's absolutely no training or any kind of further education that happens in the UAE for someone who has met the minimum requirements for licensure. I hope you.
So basically, what you
but of course I'll give you the exceptions. I'll give you the exceptions. Exceptions will be one. You come from Kenya, for example, and you've done 1 year of, after internship. If you're a doctor or, even a nurse, after completing the internship, you've done only 1 year. What they do is that they'll give you a chance. This is for Dubai only. I'm well versed with Dubai because I've researched more on Dubai, and I know about Abu Dhabi, but
Yes.
Dubai, you have to, if you have done 1 year, or let's even 6 months only, they'll give you an option.
Yes.
You can go to a government hospital in here in Dubai. You can go to Dubai Hospital. You can go to Latifa Hospital. You can go to Rashid Hospital. You go there, you train for the remaining. Like if you're having a gap of 1 year, you work there without pay for that 1 year, and you also pay them because it's like they are training you. You go and pay them to work in that hospital, and after 1 year now they'll tell you now you have met the criteria, now you can get your license. That's for a person who is coming in and they didn't know that you're supposed to be having 2 years. So instead of going back home, they can pay some money. It's not a lot of money because I've had friends who have paid the money and finally gotten the license. I had a friend of mine from Nigeria who finished 6 months and now she has the license. So it's not a lot of money, but you have to
Yes.
pay the money, and you have to note that you'll also work without being given any money.
Okay. So you said the whole process takes at least months, right?
The whole process, Abib, I would not lie to you, but the whole process, just a minute, just a minute, sir. Whole process would take some time because of the data
Okay.
flow. Because now if documents have to be sent home, it means that now you have to, you have to wait, you have to chill. Huh? Your documents are sent, you
Yes.
don't even know what is happening, because they don't tell you what's happening. Then you chill, and you will be, you know how UAE works. You'll just be receive an email and they'll tell you now it's okay, now go, like that.
All right, Dr. Ryan. We got the second question here. You've already talked about the DHS certificate, and we
Yes.
also have what are the demanding medical practitioners that are required at the moment? The types of nurses.
Okay, medical practitioners that are needed here in the UAE, of course, it's all cadres, but then I will tell you for free that nursing in UAE is a hot cake. I'm telling you that because I've worked in a COVID response project, that in Abu Dhabi, and I was the coordinator for recruitment of nurses into the project. So unfortunately that I didn't get a Kenyan. I only got one Kenyan, and my friend, I think he was called former companies, Joseph Mwangi. I know he'll watch these. He went to JQuat. He was recruited for the project, but then he didn't continue the project. So nurses are on high demand. The COVID project itself,
Okay.
more than 2,000 nurses were recruited. The company that I worked for recruited more than 1,300 nurses to aid in the COVID response project in Abu Dhabi and some parts of Dubai. That's just Abu Dhabi. So nurses, when you talk of nurses, let's talk about these 2 years of experience. Okay, let's talk about them having completed the internship, because I don't want a nurse to come here and get stuck. Let's talk about the nurses again having experience in certain other fields. Like right now, Habib, the people who have been, who COVID has really affected and they are going into ICU, the government of the UAE needs them to, needs nurses who are specialized in ICU to go and take care of such certain patients. So if you come to the UAE and you have such, subspecialties and specialties in those small fields, you are like at advantage as compared to someone who has just finished their diploma or their degree and they are coming fresh. So I'll tell you, ICU nurses are on demand. uh the normal runner nurses, registered nurses are also on demand, but not as nurses who have experience. And nurses, they are looking for in charge, like someone who has 10 years, someone who has 5 years. So at least 3 years of experience would be good. But then I would not tell you that, like the general nurses are not being taken in, because of course, Kenya is one of the countries that trains healthcare workers to the highest, to the highest skills and the highest standards.
Okay. Again, on that question, if someone is a nurse and is in Kenya, can they apply online?
Yes, they can. Even here, just like you have agents, applying for visa for people, agents doing several things, you can still use the same agents, so long as you have your documents attested at the embassy, at the UAE embassy in Kenya, you can still use the same, you can apply online for the data flow process to start taking effect before even you come to the UAE, because that time it will even be better for you, because in case something additional is needed, then you can respond from home, as opposed to when you have traveled all the way to the UAE and you are told that just a single document, for example, is missing, and that document you have to go and sign for it in Kenya so that it can be released. So yeah, they can apply, and in case of anything, in case someone needs, the process, the procedure, the DHA website is very clear on this. If you just go online and do,
Okay.
DHL licensing, it will bring you a PDF of more than 140 pages on what's required, and you can send it. You don't have to be in the UAE. You don't have to land here in the UAE for you to apply for these jobs, as a healthcare workers.
I would like you to also talk about the salary.
Okay, sure.
Of course,
Uh,
For Kenyan, that's what Kenyans like to hear.
yeah, sure. Wakenya wanapenda kusikia mshahara, na again, I will tell them one thing. I'll give you a salary range. Let's start with what? Let's do nurses, let's do pharmacists, let's do doctors, because those are the other ones. There are other professions I understand, like medical laboratory. Those are taken according to, like if a company needs someone to work for, permanently, or a contract, you are taken according to that. Like during the COVID response, we had even people being recruited who did other courses, that like emergency medicine. There are people we call emergency medicine technicians, for example. They were recruited for the same, but you find that these are rare cadres that get into jobs in the UAE. So let's start with the doctors. Doctors, after your license, uh, if you are licensed in the UAE, your salary, of course, should start from 15,000 and going up. There's no one who is going to offer you less than that, and of course, there's no one who is going to advertise a job for less than that. So 15,000 is an equivalent of 420,000 in Kenya, or thereabout, because it's use 28, use 29, 420,000 you will get. For the
Yes.
nurses, again, it spans from 4,000 to 8,000.
4,000 to 8,000.
Depends on the, like if you go to a government hospital, they have a standard rate, maybe 8,000. If you go to a private hospital and it's trying to come up, and they see you don't have experience, they'll start with 4,000, which again, the conversion is the same. If you talk about 8,000, it's 220,000 in Kenya. But then again, like when people are coming to the UAE, they should be having open minds. By open minds, I mean, like you should not come focused on a certain job. Like, I want to go to the UAE, I'm trained as a doctor, I'm going to work as a doctor in a hospital. Because you also realize that in the UAE, okay, there are so many medical legal issues. Like, people would be very afraid, people would be, even the HR managers would be not be comfortable really uh, employing someone who is trained in Kenya, despite Kenya having some of the best healthcare professionals. They prefer other places and other nationalities. So when you come in, like you always say, get experience from even other fields. Get experience in insurance, get experience in administration, such that when you get to that medical profession of yours, people will be respecting you and they'll be seeing you as someone who knows the UAE. So you should not come even before your data flow comes out. You should be doing something, and I hope you'll be giving them, of course, some tips on how to tarmac, how to tarmac and look for other
Yes.
jobs, yeah, other jobs as opposed to just sitting down and waiting for, because apart from now that we are having a high demand of healthcare workers due to COVID. During the normal times, I don't know. I don't think it's usually that high demand. So you might go somewhere and they tell you they are giving you a salary of 3,000, and then you go to another place which is health and is not in the hospital, but they say they are giving you higher. Which one will you go for? It's all our experiences. So they have to really, you have to come with an open mind and really know exactly what you've come for. It's experience, and after experience is job.
All right, so we just want to do a summary of what you've really talked. Umesema we talked about the whole procedure of getting all your documents together kwa Kenya.
Mhm.
Then you talked about where to do your attestation. Hiyo ni City Square. To be precise,
Mhm.
you said room 2,
That that too, that
and
too.
yeah, yes, and cost about 160 dirhams. Sijui kama nimekosea.
Tuite tu 5000 ndio ikuwe kwa mtu
5,000
mwenye kwa mtaani ajue ni 5000 per document. Like kama
yes,
unaenda
per
upeleke
document.
KCSE, ya KCSE
Yeah,
tuseme, na upeleke degree na upeleke license, hizo si ni tatu, itakuwa 15000.
yes.
It's as simple as that. Yeah, so
So
and,
five
mm,
thousand per document.
yeah, per document.
Yes, we talked about the nurses that are on demand or in demand
Mm.
Dubai. We talked about the ICU nurses
Yeah, nurses who
on
have
high
done
demand.
ICU. Nurses who have done
Yes,
ICU, nurses who have done something called anesthesia. Anesthesia is the medicine that is given to people in theater to sleep so that they can be operated on. People who have done anesthesia also are on demand. People who have done respiratory medicine, like just as a certificate or just as a special training. Nurses who have also done other, like midwifery. Midwifery is like, assisting in child delivery and such. The ones who have done those specialties are more, are on higher demand, because when you go to a hospital, you'll be able to be assigned a very specific duty. So those are on high demand as opposed to the general, the ones who just come as general nurses.
we also talked about the salary range. Maybe just go through column to ajasikia. Just go through about. You talked about the salary package here, doctor. Also, you talked about the salary doctor, the range here, nurses. Just run through it. Mwenye hakutupata can have an idea of what you said earlier on.
Of course, UAE really recognizes, specializations that come from countries that are not, from, like people are not Western trained mostly. And when I talk about doctors, I'm just talking about a doctor who has a degree in medicine and surgery. I said it's a 15,000. It's a starting salary. Unless now you are going, you see, you can also go to a friend's clinic who is starting and you want to help them grow. So you can start with a salary lower than that. But let's talk about uh, 15,000, and it goes all the response up to around 35,000. Like in the corresponds, no doctor was
So,
being paid, of course,
so
that.
this,
Yes.
so unajua kuna watu wako Kenya wanashindwa 15,000, is it Kenyan bob ama 15,000 dirhams? So that's equivalent to around 300,000, right?
That's around, no, it's around 420. Because you use 28, it will give you around 420 something thousand.
Hey boss,
Because
uko poa with
15,000,
figures.
if it was, yeah, I'm very mathematics was my thing. Na hapa tunahesabu pesa pia. So, and for the nurses,
So
I've told
that,
you again. For the nurses, I've told
yeah,
you again, and I repeat, you might go
uh,
into a small clinic and where you are given small shifts, they can start you at 4,000, but it will go all the way to 8,000. And if you are a specialist, again, you are a nurse and you get a rank, the salary, of course, will be good. So it goes with experience. It goes with experience.
Uh, One more question before I forgot about do they provide accommodation with this kind of salary package?
Yes, most of the if you get a job as a healthcare provider, most of the jobs give you accommodation. Even the most high end hospitals and clinics like Cleveland, they give you accommodation, and even if they don't give you that, they give you an allowance for the accommodation and transport, all the same. And they give you uniforms, what we call as scrubs. They give you, unaonanga wakitembea huku na nguo zinakaa za dieta. They give you those uniforms, many of them, and they wash for you. They wash for you, yeah. So basically, they make sure that the healthcare workers are comfortable. So especially the people who are working in government facilities, like when you go to Dubai Hospital, when you go to Rashid Hospital, Latifa Hospital, you'll find, yeah, it's like that. It's good. Things are good, and
All
they
right, thank you
appreciate it.
very much, Dr. Ryan. I want to say thank you very much, Dr. Ryan.
Mm-hmm. Yeah.
One more last.
Mm-hmm.
What kind of services do you offer? Like, do you offer any services, and where can you be
Currently,
found?
yeah. Currently, personally, I'm a freelancer. I'm a freelance. Like I think I've been a freelance all through. And I
Yes.
am into health insurance. That's my passion. And later on, maybe I'd practice, my medicine in hospital. But then I'm on freelance again. Like I can still do everything the other general practitioners do. I can still consult for you. I can still write prescriptions for you. I can still see you, yeah. And I'm available, like I'm available outside duty hours. I'm available, but then I'm concentrating on health insurance, because it also needs that medical knowledge. And you know health insurance in the UAE is not like health insurance back at home. Here, health insurance really needs a lot of critical thinking. Here, procedures, things that are done. Even how diseases are treated here, it's different from how diseases are treated elsewhere in the world. And it really needs health insurance here needs people who are sharp, and people who are actually able to make decisions very fast about health conditions of members who pay to the insurances, so that they can get optimal services. So that's why I chose that. And it's been kind of like my passion. But later on, of course, I'll of course be going to practice my medicine as a doctor, even when of course my glasses become bigger than they are now.
Sawa sawa. Kuna mtu aliuliza about what can you advise Kenyans in regards to this pandemic?
Basically, and before that, you had asked where they can find me. Like my numbers.
Oh,
You
yeah.
have them and everything. Yeah, you have my numbers, and so there's no problem. In case someone is suffering, in case I usually say, in case a countryman is suffering or a friend of ours is suffering, there's no need of them staying in the house and getting sick, and getting worse. So they can always reach us and see how we can help. Of course, for free. We don't for free, because we are not in hospitals. So about COVID, this has been a very big blow, because it has affected economies, it has affected livelihoods, it has affected how people carry out their normal daily activities. I'll take a case scenario of my home country, which is Kenya. Actually, it's made everything stagnant, and it's not something to smile about, of course. And scientifically speaking, this is something that is expected to be here with us for much more longer. It's not, even the UAE itself. We had done 200s. Right now, today it was 391. I usually follow them. Yesterday it was 420. I mean, the day before yesterday, they usually release for the day before. Today it was released to 391. The other day it was 420. So we are going back again. But by going back, what I would like to advise the society, and more so the society that I come from, is that going back to infections, new infections, uh, more people testing positive, it's not really a sign of virulence. By virulence, I mean the strength and the strength and what do you call it, and the harm that is caused by the virus being more. It just means that this is a flu. It's catching us. It's just because that we've not been going around testing for influenza virus, which is also a flu. If we tested for influenza virus, we'll find, of course, almost everyone having it. So the same with COVID. So long as you are not sick and from it. By sick, I mean people really don't understand what COVID is. Habib, do you know what COVID is? No, I'm asking you the questions, and you've been interviewing me all through. Do you know what COVID is?
From my side, maybe the my understanding about COVID, I'll be very honest with you. I don't have much information about it, but what I know
Okay,
is that
okay,
COVID
okay, okay,
eco.
okay. Let me help you. COVID eco, but COVID, COVID is a disease that is caused by a virus called the coronavirus. Coronavirus of 2019, and a new coronavirus that was like that was found to exist in 2019, that was discovered in 2019, and that's COVID, coronavirus disease of 2019. There's a difference between coronavirus and COVID, because COVID is a disease, coronavirus is the virus. So Habs, even now, even if you tested me or you tested another person, because me, I've tested 5 times. I've never, of course, thank God, I've never been positive for COVID, for coronavirus. But many people are carrying coronavirus in their systems, but then the copies of the coronavirus that they have in their bodies are not enough to cause them symptoms of the coronavirus disease, which is sore throat, sore throat, and difficulty in breathing, and sometimes fever. So people should not panic, and so especially in Kenya, because the cases will go up. Right now we are 34,000 today. The cases will go up, especially in these low income countries. Even if they went up, this doesn't mean that like an advice just to the we can't advise the governments, but this doesn't mean curfews or lockdowns or anything, because ultimately, and like a scientist I would say, everyone in the next 5 or 10 years, everyone would get COVID, the coronavirus infection, but not necessarily develop the disease. And people will develop what is called herd immunity. Immunity that when you get the virus, your body forms the defense, which is called the antibodies. That those antibodies will remain in your body when you recover from the virus, and when you get it tries coming back again, it will be fought like no one's business. So most people will get that immunity. People who are at high risk, like people with diabetes, ile uskari ya ugonjwa askari, people with asthma, people with
Yes.
HIV and AIDS, and other conditions that bring your immunity down. Those are the people now we should be taking care of, to make sure that they are not exposed to this virus. So that, of course, because if they are exposed to the virus, they are likely to go down easily. But someone like you apart from putting on the mask because you are going to be chased by people, you're just supposed to take care. Keep the social distance. You don't know the outcome. You don't know how it might come out in you, like if you got the virus. So we are just taking care, but then people should not panic, because coronavirus is just a virus like another. It's just like influenza. It's just like rotavirus. People will get sick. Some will get very, very sick and may succumb, but then the general population might still remain strong.
Thank you very much, Dr. Ryan. Uh, what kind of food should we eat to boost the immunity?
Yeah, sure. Yeah, that's that's coming in handy because even a friend of mine today was asking me at work. Oh, this thing, COVID. These days, when he gets even a small flu, he wants to grind ginger and what and not even drink, just put in the nostrils so that it can go down and kill the virus. But of course, vitamins, and more so vitamin C has been, has been talked about so much that it causes, it improves symptoms if you had symptoms of COVID. So vitamin C, you'll get it from citrus fruits. Well, the ones that are grown in the Mediterranean, oranges and lemons, vitamin C. So you can use vitamin C, other things like lime, ginger, garlic. You can combine all those things. Make it a routine of just taking a cup per day, and of course other things that boost the immunity. Like taking green vegetables, taking a lot of fruits. And one thing that people should know is that COVID symptoms are really improved by adequate rehydration, which is taking a lot of water. Personally, I take 1 point something liters a day. Taking a lot of water and having a good sleep. Having a good sleep of an adult is more than 6 hours a day really improves the symptoms if you got symptoms of COVID, and it improves recovery from COVID also. So those are exactly the things. But of course, Africans eat kunde, nini. Those things have so much, so much nutrients. I don't know.
Asante sana, Dr. Ryan. You joined us. I think you joined us. I don't know if I'm not sure. 3 months ago, or I think at the beginning of this year. Sindio?
Yeah, I came in just before the lockdown. I came in March, and I've been here for the
Okay.
last 5 months.
Okay.
Yes.
What do you say? What do you think we should improve at KID? And what do you say about KID members?
Okay, one thing about Kenyans in Dubai, what I would like what I would like to advise them is that we are away from home, but despite being away from home, we are still family. So, and that's why we call it kid family. So people should strive to help each other. People should strive to be united. People should strive to, like I was see, like I saw some video that was circulating in social media about some man who had a job, a teaching job. I think you saw it, a teaching job, and he approached an African guy and told him to go and look for a teacher for him, and they should start immediately. And the salary was 2,000 dirhams. And this guy went ahead and started asking commission from the fellow Africans. And of course, like right now, if you ask someone who has not been having a job since March in the UAE, you ask them a commission of 2,000 or 1,000, even 1,000 dirhams, which is an equivalent of 30,000 Kenyan shillings. It's very difficult. So we should shun away that mentality of not even mentality is I can't. It's barbarism. It's something that I cannot really describe with good words because we should. If you get an opportunity, just the other day you send me an opportunity. I send people to that opportunity. Whatever the outcome is, good or bad, those people will remember you in their prayers, or God will remember you. If you have a hustle, don't strive so much in trying to extort others or taking money from others so that you can avail to them opportunities. And of course, during these difficult times, we remember each other. There are people who are not having jobs. So if you have something, even if it's some food, and someone somewhere who is sleeping hungry, make a point, of sharing one or two, and that's what family do. If really we are family, about
Asante
improvement,
sana. Yes.
yeah, about improvement, I don't really see anything to improve about because we've been in touch. It's a network, and the only improvement that it should be there is like just being humane and being human and being a family that we could be in Kenya, back in our home country.
Thank you very much, Doctor. I also want to say thank you very much for creating time. Najua umekuwa na busy schedule and I do appreciate for creating time for us, and I'm pretty sure in future you'll be joining so we can keep the conversation going. Thank you very much for everyone who was watching, and please subscribe to our YouTube channel. Tumeanzisha YouTube channel which is this one, so we'll be having more people on board. We'll be having people to talk about finance, people to talk about health insurance back in Kenya as well. Also going to have some HRs on board to talk about employment in Dubai. And if you give us support, if you keep subscribing, because sometimes we cannot link the YouTube and FB, so saa zingine tutakuwa tunaenda live on YouTube. So if you subscribe to our channel, we're going to have much information left there.
Thank
If
you very much,
someone
Abib.
wants to talk about, yes, ukiwa na rafiki yako anataka kuongea about anything, like something to give back to the society, will be more than to host him.
Thank you so much, Abib. And thank you for your
All
time.
Right. Thank you.
Thank you.
All right. Thank you very much, sir. Have a nice evening.
You too, bye.
All right.